Hello, my name is Mariela Castaneda and I will be talking about pneumonia. So first I will be explaining what pneumonia is. Pneumonia is an infection of the lungs, and specifically it targets the alveoli of our lungs, which is what our lungs are made out of. And so as you can see in image B, there it shows some healthy alveoli. So when we breathe in oxygen, the alveoli expand, and when we breathe out carbon dioxide, the alveoli shrink back. And then as you can see in image C, the alveoli is filled with pus and liquid, and that's not good because it causes some painful symptoms, and there is also less oxygen intake. There are a lot of symptoms that pneumonia causes, and here are some of them. There is cough, fever, sweating, shortness of breath, painful breathing, chest pain, chills, nausea, vomiting, drop in temperature, which it seem a little controversial because, I also put fever, but I will explain that in a few slides. And there's also blue tint to the lips or fingers, as well as confusion, which makes sense because if you're not intaking as much oxygen as you're supposed to, then that means that there's less oxygen going to the brain, and therefore a person can become confused. There are different types of pneumonia, and each of these types of pneumonia have specific symptoms related to them, so I will speak about those. The first, most common type of pneumonia would be bacterial pneumonia, which is where bacteria enters the lungs and that leads to pneumonia. Some specific symptoms would be a blue tint on the lips and fingers, loss of appetite, low energy, stabbing chest pain, and even green or bloody mucus. The second most common type of pneumonia would be viral pneumonia, which is caused by a virus or other illness. So, for example, a person could get sick with the flu, and then the flu could get worse, the symptoms could get worse, and that could lead to pneumonia. Some specific symptoms for that would be increased shortness of breath, headaches, cough that keeps getting worse. The third most common type of pneumonia would be mycoplasma pneumonia, which is caused by a bacterium called Mycoplasma. And a specific symptom for that one would be a severe cough that produces a lot of mucus. The fourth category would be other pneumonia, and these are types of the pneumonia that are not very common. There's not enough cases of those types of pneumonia to be placed into a different category. So there's that. The way pneumonia is transmitted, it's an airborne type of transmission, so through droplets, if somebody sneezes or coughs, the germs can get on surfaces or on other people if they're close by, and the other person could get infected and, get pneumonia, or also through blood, which that's more common in birth, if maybe there's not a clean or sterile environment, the baby could get infected or the mother as well. And the way it is acquired, there's two common types. So there's aspiration, which is when a person breathes in vomit or food and that gets stuck in the lungs and that develops into a bacteria, and that's just really bad and that can cause pneumonia. There's also community acquired, which is the most common, and that is when a person gets pneumonia either in a hospital or other healthcare setting, and that's really dangerous because bacteria from those settings could be resistant to antibiotics, which is really bad. Now I will talk about the epidemiology. All age groups can be affected by pneumonia, but the two age groups that are most affected are children under 5 years old and older adults, but older adults do have the most recorded cases and death rates. When I refer to older adults, I refer to people who are ages 65 and older. They are the most vulnerable group and the group that has the most hospitalization and death rates recorded, and this age group is most commonly affected by bacterial pneumonia, and they acquire it by community acquired pneumonia, and this is common due to the fact that there are many older adults who live in nursing homes or maybe who are in a hospital due to other conditions, and that can cause them to develop pneumonia. And just in general, as a person ages, the immune system and other functions of the body get weaker. But if an older adult has diabetes or COPD, which is chronic obstructive pulmonary disease, or if they smoke, that weakens the immune system even more, and it makes it a lot easier for bacteria to break through the immune system and, infect the lungs and cause pneumonia. There are also high rates of aspiration in older adults, and that older adults' gag reflexes may not work as well, which may cause them to not be able to cough as well, and therefore the mucus stays in the lungs, and that can either cause them to develop pneumonia, or if they already have pneumonia, that can make the pneumonia get even worse. So, disparities, race and ethnicity wise, I found a little controversial just because there were some articles or journals that said that race and ethnicity wasn't really related to pneumonia, and other articles said that they were related to pneumonia. But some other disparities were living conditions. So, people who live in poverty, maybe they don't have enough money to buy, good nutritional valued food, or, the air may be contaminated, and that really affects somebody's immune system. And gender, there is one gender who has a bit more cases than the other, and I will speak about that in a couple of slides. So this graph shows the hospitalization numbers. So the group with the lowest number of hospitalizations are those who are ages 18 through 24, and this would be, for example, 69 cases per 100,000 adults per year, and the group with the highest number of hospitalizations would be older adults who are 85 years and older. This graph shows the incidence rate for people who have pneumonia and other health conditions. So the highest hospitalization rates of people who have pneumonia and other health conditions would be those who have COPD, and it's about 5,832 cases per, again, 100,000 adults. And people with obesity have the lowest number of hospitalizations with 674 cases. This graph shows the death rates, and so females have slightly higher death rates due to pneumonia than males, with females having about 28,000 and males having 25,000. And the race that has the most deaths are whites with 42,000 deaths. This chart shows the death rates by age. So as we can see, people who are 65 years of age and older have the highest number of death rates with about 45,000 death rates per 100,000 people, and the lowest death rates would be for those who are 5 to 14 years old with about 67 cases. Pneumonia is really important to public health due to the fact that there are so many hospitalizations and deaths every single year. There's about 1.5 million hospitalizations and about more than 40,000 deaths per year in the US alone, and the numbers only increase every year, so it's important to find ways to decrease these numbers. I will now speak about some prevention strategies. Some primary preventions can be hand hygiene, so after touching surfaces and stuff like that, washing your hands for 20 seconds or singing happy birthday 2 times, as well as maybe, if you carry hand sanitizer, putting that after you go to the store or something like that can help kill germs. Also, creating healthy habits, which can include eating healthier and exercising, because that can boost your immune system. There's also vaccinations, which I know is a little controversial because some people don't believe in vaccinations and others do, but research has shown that vaccinations like the yearly flu shot can help reduce the risk of pneumonia. There's also another vaccine called pneumococcus, which that is important for people who are at high risk of contracting pneumonia. There's also another vaccine called the hip vaccine, which is recommended for children under the age of 5. It not only helps to prevent meningitis, but also it helps with bacterial pneumonia. Secondary prevention: if a person is already infected with pneumonia, some things they should do is see a doctor who will most likely order some exams, so for example an x-ray and CT scan, so they can get a better look at the chest area. There may also be sputum culture to test for infection, blood test, and other exams. Some treatments that could be given are antibiotics, and it is really important for a patient to take the full dose of antibiotics to make sure that all of the bacteria is killed. A person may also get IV fluids or intravenous fluid or oxygen therapy. Some at-home remedies could be taking a cough medication, drinking warm liquids, or having a humidifier, which that allows to open the airways, as well as taking anti-inflammatory drugs or aspirin. But it is really, really important to talk to your doctor before trying these at-home remedies. Tertiary prevention strategies once a person is in recovery. Rest is really important so that a person can regain back their strength, and also protecting others and self. And this can be as simple as covering mouth and nose when sneezing or coughing so that germs won't spread to others. Or now, after COVID or still sort of in COVID, wearing a mask if you're sick or you have pneumonia so that germs won't spread to others. It is also recommended to limit contact with others, again, so germs won't spread to others and they can get infected. And once a person is in recovery or they feel better, a doctor may order more x-rays to make sure that the person's lungs are okay. Some actions that are being taken to lower the cases of pneumonia: there are vaccination campaigns, as I mentioned earlier. Research has shown that vaccinations do lower the risk of getting pneumonia. So, some vaccination campaigns, as we see every year, the flu shot is promoted as well as other types of vaccines. And now you don't have to go to your doctor to get the flu shot. You can go to a pharmacy like CVS or somewhere else, and they can give you a flu shot. Also, in 2009, World Pneumonia Day was created, and every year on November 12th, people are educated about pneumonia on social media, television, and other platforms, and there are also strategies given to protect yourself and how to make your immune system stronger so that you don't get pneumonia. And here are just my references and resources. That is the end of my presentation on pneumonia. I hope you learned a little bit more about pneumonia as well as steps you can take to protect yourself and others. And I am looking forward to watching other of my peers' presentations.